In our clinic, the focus is to identify the underlying cause of the patient's pain and provide targeted interventions to treat that cause and to help relieve the patient's pain. And we do that by listening to the patient's story and understanding their history of their pain, combining that with our physical exam and a review of advanced imaging that's been performed to identify the underlying cause of the patient's pain. We then use that information to develop a personalized, targeted approach to treat the patient's pain and perform procedures to target those structures that are causing the patient's pain.
So I use a multimodal approach to treat pain that involves non-opioid medications, procedures, and other kinds of therapies such as physical therapy or behavioral therapy. The reason we do it is because it's easier and it's most effective to treat pain doing multiple things than just prescribing one single medication. This plan can be as simple as, we're going to do an injection to treat your pain, up to, we're going to have to do a couple of things, such as we're going to start this medication, we're going to schedule you for this procedure, and we're going to send you to physical therapy. It's difficult to have a single approach because every patient is different, and what is good about my specialty is that we treat the patient, we don't treat the disease. So we are going to treat you and we're going to treat your pain in the best way possible for you and for how the pain is interfering with your life.
So all of the physicians that are serving patients in this clinic are anesthesiologists by training who then obtain further specialized training in pain management. Our physicians work very closely with the physical therapists in our institution. We also work very closely with our spine surgeons and our joint surgeons. And then we also work very closely with our neurologists and rheumatologists, as well as our primary care providers throughout the system to help identify those patients who have been dealing with pain for a long period of time to see if there's any interventions that we can offer to help them in relieving their pain. A lot of patients, particularly patients who deal with chronic pain for an extended period of time, have a lot of concern with how they'll be treated by physicians who are evaluating their pain. And a lot of patients have had experiences that are very frustrating for them with the healthcare system in trying to treat and deal with their pain. And one of the things that we really try to focus on in our clinic is to treat all patients with respect, understanding that they're dealing with a very difficult condition and dealing with their chronic pain that's affected all the different areas of their life. And as a result, we try to focus in on how we can help them with their pain and get them back to doing those things that they enjoy doing.